Hi, my name is Ethan Langlois. I'm an LPN, work at the Converse Home, and here to talk about my project involving improvement of safety for both patients and staff during transfers. So I'll go through the agenda of what I'll be talking about during this presentation. I'll start with the need for improved safety, both on the patient side and on the staff side. Um, and just describe why I think it is needed and how it can be improved. Then I'll go into the project description and then a timeline of that project, go through the budget that'll be required to implement this project, um, and then I'll wrap up with some final concluding points and then answer any questions that may come up. So there is a big need for improved transfer techniques in the healthcare. Staff injuries are fairly common compared to other fields, and there are several modifiable risk factors um, that would lead to decreased injuries. Lower back pain has a 96% prevalence over a 1-year study conducted in 2020 by Vinstra. And they found that assistive devices have the highest efficacy for reducing those rates of injuries. Because daily patient transfers are associated with a risk for back injury, but persistent use of those assistive devices will lead to a decreased risk, but more commonly, there are a lot of barriers that staff face, which include lack of equipment availability, lack of time, a lack of education, or a lack of enough staff to be able to have that time. Um, in 2020, the U.S. Bureau of Labor Statistics also found that during the peak of the pandemic, there was a 249% increase in staff injury and illness um, compared to the prior year before in 2019. And the National Safety Council also found that same year the average cost to replace the staff while they were injured was about $1,100. But if it was a more serious injury and it had to be medically consulted, then it'd rise up to $44,000, which is a significant cost, which adds up over time for facilities. Um, so on the other side, there's also a big need for patient injuries. A study conducted in the United Kingdom found that approximately in their hospitals, 250,000 patient falls are reported each year. And adjusted for our population, that'd be about 1 million falls each year. And about a quarter of these falls lead to injuries and care that facilities won't be reimbursed for. So quite a bit of money loss. And they found that the appropriate use of assistive equipment leads to less patient injuries and less costs overall for facilities, so they can hopefully keep providing good care. So the project that I would like to implement would just be ordering and increasing the availability of stand-up pivot transfer boards. We currently use gate belts and they are very effective. Um, but with gate belts and doing a stand-up pivot, there's still quite a bit of manual lifting that can lead to back injuries. Um, and stand-up pivot transfer boards are able to provide a greater level of stability for residents while transferring, um, and place a lot less strain on the caregiver's body, since the residents are able to support themselves a little bit better. Um, and they found these have reduced rates of injuries for both patients and staff. Um, the transfer boards come with or without handles. I prefer the model with handles just because it adds a little extra stability. And to use these, the residents will need to be able to at least maintain their own weight. So obviously, people that require a Hoyer lift will not be able to use these. Um, but these would be great for transferring to a commode or to a chair nearby, with a resident that has more limited range of motion. So brief timeline of the project that I hope to implement. Um, May 9th, hopefully the project is approved. And then the following day we could get a purchase order for gate belts, just to increase the availability of those as well. And stand-up pivot boards. Plan to get at least 3 for each floor. And then by May 16th, have the initial education for all clinical staff on how to use the stand-up pivot boards and when to use them. Then by May 30th, all employees will complete a skills assessment and be checked off to be able to use those. And then June 15th, an evaluation of the project to look at the prevalence of the percentage of falls in the first month compared to previously before the stand to pivot transfer boards. And in addition, be handing out surveys to gauge staff and patient responses to this project. So the budget needed, average, the stand-up pivot boards are about $400 each. So if we get 8 of those, it'll be $3,200. Gate belts are relatively inexpensive, so we can add 10 to each floor, just so pretty much every resident has a gate belt in their room if it needs to be used. And that would add up the combined total to $33,424.30. So in conclusion, safety is obviously the number one concern for both patients and staff. We want to provide good care, and we want to make sure our patients feel safe and our staff feel well supported. And with these standard transfer devices, there's reduced rates of injuries for both parties, and a reduced cost associated to the facility for patient and staff injuries. And with that reduced cost, hopefully, could be put back into the facility and used in other areas to improve. And in general, stand-up pivot transfer boards are easy to learn and use in practice. It's just knowing when to use them, what residents should use them, and when they shouldn't. But having them basically stand up with assistance with the gate belt, hold on to the bars, and then you just turn the transfer board, and then they're able to step back down and transfer into the seat. So that was everything for my project. Thank you for your time, and I'm happy to answer any questions if you may have, or if you would like to reach me, I'll give out my email and you can go from there. Thank you. And here's some references. Have a good